Hi, my name is Somaiah Aroori. I'm a consultant liver, pancreas, and a general surgeon, and also a transplant surgeon. I do a lot of operations laparoscopically. So laparoscopic suturing is the integral part of any laparoscopic surgery. Most of the times you don't need to use it, especially if you're doing a simple, straightforward operations like cholecystectomy or appendicectomy. But anything more advanced than that, for example, if you're planning to do a laparoscopic bile duct exploration, you must know how to suture the opening in the bile duct. So it's a very, very important and essential skill one must have if you're planning to do any advanced laparoscopic or robotic surgery. So what we're going to demonstrate now is how to do the laparoscopic suturing using a single-handed technique, using a 3/0 Prolene suture on a piece of pig's liver tissue. And I will also go through some of the pitfalls and some of the common mistakes people do or the trainees do. I hope you'll enjoy and you'll learn something. Thank you. So the first thing you need to think about is the needle holder. Depending upon whether you're right-handed or left-handed surgeon, you need to choose either right-handed or left-handed needle holder. This is the needle holder I chose. The important thing is the flexi tip, the tip which moves, should be on the top. The base needs to be fixed. Then I need to think about what suture I'm going to use. So for this exercise, I'm going to use the 3/0 suture. So that means the needle is big enough. It will not go through the 5mm port. So you have to have a 10mm port or a 12mm port to insert the needle inside. Then I will decide about the length of the suture. I usually use a Mayo scissors or the port, the length of the port. Okay, so that's the length of the suture I'm going to use, and then I'm going to cut it. If you cut it there, please. We're going to use a 3/0 suture for this. We will put the port back in here. Then in terms of the mounting the needle, I'm going to mount it right at the junction of the hub of the needle. You see, that's the hub, and the suture, where the suture is entering the hub. So just hold it there. That means the needle is actually free to move when I'm inserting through the port. Then I'm going to, Liam is going to be my helper here. So he's going to put the camera in. Okay, so we're going to practice this on a piece of liver. So we're going to put the needle inside. Now, I'm not going to drop this. If you drop it, then it takes a bit of time to find the needle, grab it again, mount it properly. It's unnecessary wastage of time. So can you go in, please, Liam? So what I'm going to do is support or grab the needle with my left hand, all right? And then let it go with the right, and then just hold it in such a way that I can go and grab directly with the tip of the needle. Now the key here is you need to think about the angle between the needle and the tip of the needle holder. It should be just over 90 degrees. So that means tip is looking away from it. And I grab it in the middle rather than 2/3, 1/3 junction. Both in the open and laparoscopic is exactly the same. So that's in the middle, okay? Pretty much middle really, I will accept that. And then decide which tissue you're going to suture through, and then you need to go here, we're going to stitch with a piece of liver. So you go 90 degrees to the tissue, and then use your wrist to twist the needle to get it out, okay? And don't grab the tip because that will destroy the needle. As long as you protect the needle, tip is okay. So here, I'm not actually holding the tip. I'm holding the tip but without destroying the tip, okay? And then what you need to do is support the tissue, and then you just follow the curve of the needle and then get through the tissue. If you're struggling, then re-grab it and then follow the curve of the needle to remount it, pull that through the tissue. And then what I'm going to do is to form a C-loop and reverse C-loop with my left hand, and use the right hand to needle holder to go to the C-loop. So here, this is a C-loop, that's a short C-loop, so I'm going to make it a little bit wider. So there you go, it's a little bit wider. I'm going to go under the C-loop, okay, with my needle holder, and then grab the tip at the short end. Now, the short end is not short, it's still long, so what I do is when I pull it, I pull the long end so that the short end is not going to be any longer, or it doesn't become any long, okay? So there you go, perfect reef knot. Now this is Prolene, so you can put 2 throws or a single throw, but let's try with a single throw if it's going to stay. It's going to probably stay, okay? That's good. That's stable enough. Now, I'm not changing my left hand the suture to the right hand. I'm using the same left hand, and now this time the C loop is reversed. So initially, first time we did this proper C loop, this time reverse, and then I'm going to go on top of it now rather than underneath it, and then grab the short end of the needle, suture, and then pull it through. Okay, and look at this. Show me please. Yeah, look at the perfect reef knot, figure of 8. Okay, and then suture and then tighten it. Now I don't know whether you've noticed it or not, but my left hand, I haven't dropped my left hand, so the needle is also free to move. It's not fixed, so the likelihood of you stabbing something is very, very low. Whereas if you hold it, for example, do like this, which is fine because you're protecting the tip of the needle. But if you hold it somewhere here with your left hand and then you try to do the rest, the tip can basically injure something. So don't do that. Try and avoid holding the needle in the middle. If you want to hold the needle and to use a bit of for an extra length, I'll show you in a minute. So that's it. So we've done this second time. We're going to go back to the third one, and then third one is obviously going to be the same like the first one. And then you cross your hands, you got the perfect figure of 8 or reef knot. And then the fourth one is same as the third one. Second one. So the first and the third one is the same, second and the third one is the same. And I haven't changed my instrument, I haven't dropped the needle. I come back a little bit please. Okay, I haven't really wasted any range of movements with my left hand. It is still holding the suture and it's the right hand doing. So you can still carry on. It's actually quite fun. It's quite almost, I would say, addicting because you're enjoying the suturing. It's perfect square reef knot. Okay, and you're literally using a left hand to form the C loop and reverse C loop. Okay, and then we're going to cut it. Then now I'm going to go through a few the pitfalls, or should I say mistakes, common mistakes people do. Alright, so we're going to cut this. Okay. Right, so the mistakes people do, let's grab another suture. So we're going to get another suture. So one is they can cut it too long or too short, so make sure you don't do that. Just the right side, the size. And then when you're mounting the needle, some people do this, where they grab the needle outside. Now, this is okay for a 4/0 or a 5/0, but 3/0 needle will not go through. You can try it and it'll get stuck, okay? That's really frustrating, so don't do that. So the key is to hold it between the hub of the needle and the suture, okay? So that range of movements are there. And then you insert it. And then the second mistake people do is this, they drop it. If they drop it, then you have to go and grab it with your left hand, so the angle is not going to be right. And then you grab it with the right hand, and then change your left hand direction. Okay, I'm not really making it difficult. That's how it is. Okay, so don't drop it. Just leave it on the right hand needle and go and bring the left hand and grab it the way you want to see, and then use the suture to push it around, bring it towards you or away from you. See that? The range of movement. So get into the angle the way you want to go and grab it. Okay, and don't grab it 2/3, 1/3 way, because if you do the 2/3, 1/3 way, you have so much of suture to go through. So you could go through the tissue which you don't want to get through. Okay, and then you won't have much suture. So look at this. See, it's going to be a massive deep bite. And then I haven't got any needle to go through the rest of the tissue. Whereas if you only grab it in the middle, okay, so it's easier, 90 degrees to the tissue, and then actually it's easy to go to the tissue. You can see the rest of the needle, and then you grab it, and then don't try to do this. Okay, if you do that, most likely you're going to tear the tissue. Okay, so sorry. you're going to tear the tissue. So then I drop the needle, grab it with your left hand, and then pull. When you're pulling it, try and support the tissue. Here, liver is okay, is obviously a bit more tolerant than the bowel or blood vessel, okay? So pull it, and then don't leave too long. So it's still too long, so I drop the needle again, grab the suture, pull it until, go in please, yeah, show me here. Okay, see, that's a perfect length. Yeah, we're not going to leave too long, okay? Come back a little bit, just keep it in the center. Then, so I've already actually grabbed it, and it's ready to be go really. So you got the kind of C-loop. So you can bring it like that towards you or flat. It doesn't really matter, okay? What matters is getting through that loop. So now what I've done is actually with the right hand, and I'm forming the C-loop properly. Come back please a little bit. So I didn't do anything with the left hand. It's the right hand which does that C-loop, and then without moving the left hand, I'm going through the loop here, okay, and grab the short end. But this time you have to cross your hands. If you don't cross your hands, it will be a slip knot, which is fine. You can put 2 slip knots and slip it, then it will become a zabo. But why do you do that if you can manage like that, okay? So then this loop is already there. Come back please, and then you go on top now, and then grab the short end and bring it out. The other thing is outside, if you look at it, I've also used this, the range of movements, you get it. So you can change the direction of the C-loop just with the moving this knob, okay, and that will also move. Look at, see what's happening inside. So I think I need a bit more length, okay, and use the tip of the instrument, sorry, keep it in the center please. Yeah. Okay, and don't use the belly. If you use the belly, this bit of your hands will come in your way. So literally use only the tip of the instrument, like that, okay? The other thing to remember is that if the needle, the suture length is short, then what I do is use the needle to get the extra length. So how do I do that? I will hold it right at the end. Come back a little bit, please. Thank you. So, yeah, right, so how do I get the needle to use as an extra length? So use it, hold it at the tip because the needle is going to come out anyway. So this much of the needle will give you the extra length, and then you walk around, okay? Now here we got enough suture, but if you don't have enough suture, then you could use that to get extra length of the needle. What you don't do, or shouldn't do it, is this. If you hold the needle here and then try and, you can do that, but the worry with this is that the tip of the needle will, go into some structures, especially if you're on the liver, it can go to the rest of the liver or a bowel or anything you can damage. So don't do that. If you want to hold the needle, always protect the needle and use that bit of the needle to get the extra length. Now, I want to show you zabo knot now. Okay, so zabo knot is where basically you put 2 slip knots. Let's cut the suture. And then we'll get on. Where's the scissors? So zabo knot is for sutures which has got a very, very slippery property, like the prolene. Here is okay, prolene, we managed to put those, each knot individually, but usually if it's a prolene, it won't work, so you have to put 2 slip knots and slip it, and what we call a zabo knot. Okay, so same thing, right? We grab the needle, transfer it onto the left hand, and then mount it properly, which is the tip should be 90 degrees. Sorry, the base of the needle and the tip of the needle holder should be at a 90 degrees and above angle. Okay, so same story. I need to adjust my camera person. Okay, right. So 90 degrees to the tissue. Use the curve of the needle, go through the tissue, and then hold it with the left hand without damaging the tip. Support the tissue again and pull. And now we're going to put 2 slip knots and slip it rather than like the way I showed earlier on. Okay, so okay, C. Okay, so don't tighten it, and then reverse C. Come back a little bit, please. I need to see. So now look at Okay, so reverse C now. Alright, and what you do is to pull, okay. Now here it's slipping nicely. Normally it's not that the case. Okay. So let's say, for example, do that. Even then you can slip by holding at the bottom, but I think it's fine. So, okay, 2 knots, and then you slip it. There you go. And then you cross your hands and make the knot straight and secure. And then the rest will be the same like a single-handed normal suturing technique. So cross your hands. There you go. Didn't move your left hand at all. Get a bit more length. Form the loop again. C. Reverse C. Thank you.